Hi, this is Kelsey Larson at Ball State University in SPCE 638803, and this is my case study part 3. Here's the recap information on my client. The target behaviors we've looked at so far included vocal protests and physical refusals. Here are the definitions with examples and non-examples. To train staff, we'll use BST or behavior skills training, and there are 4 steps: instructions, modeling, rehearsal, and feedback. There will be instructions given to direct technicians at the start of the intervention, and this phase will focus on explaining the functional communication response that will be taught as the alternative to vocal and physical refusals. Visual aids can be discussed in this phase, and the DRA procedure will be explained, as well as the operational definitions and target behaviors in observable and measurable terms. We will discuss the behavior for increase as well as the behaviors to decrease, which will be vocal refusals and physical refusals. The instructions will be concise so the procedure can be understood by staff and allow them to know the steps to implementing this both proactively and reactively. It might look like something written down that states if vocal refusal or physical refusal occur, then immediately prompt with asking, "How do you feel?" Use a visual prompt immediately and wait for a response. If a response is given within 3 seconds, move on to delivering praise for identifying and prompt the choice of the coping tool they want to use. And for proactive trial, this might include the client playing or eating lunch, and we would present, "How do you feel?" Then, if the client responds within 3 seconds, praise and offer the coping tools immediately if necessary. It should also outline the prompt hierarchy used. So since the client is vocal, we will be wanting him to respond saying, "I feel mad," or similar, and we will be using that visual prompt first with maybe a gesture as the second prompt. We will go from least to most prompting. Now we're moving on to the modeling phase. So the BCBA will need to model or have a competent RBT model for another technician what the procedure should look like. This will be most beneficial if the client is present during this phase. So the BCBA might choose to model themselves during a non-preferred transition when the client is displaying some vocal refusals. The BCBA will show the tech how to prompt with the visual and ask, "How are you feeling?" and show what an independent response would look like. Or if prompted, they will show the prompt that was needed for the client to respond. Then we'll be using the coping tools, and the BCBA should model the prompt level necessary for the client to choose the 2 to 3 coping tools from the bag and place them in a sequence, and then finally using all these tools in the sequence. The BCBA should model the removal of the coping tools also by placing them back in the bag and the client completing the transition successfully after their break. If the client is not willing to relinquish the coping tools at this time, the technician will be instructed to gain control of the tools, and the procedure should be followed once again with the presentation of the feelings chart, allowing the choice of a new or similar coping tools, and the process will continue until the client is ready to transition or comply with the previous demand. Moving on to the rehearsal phase. So in this phase, the BCBA will ask the technician to practice using the DRA procedure when the behaviors to decrease or even proactively with the client during session. And this will be to ensure they are competent to run the procedure as instructed for all its uses. During supervision with the client, the BCBA should instruct the technician to practice this procedure proactively. The BCBA should take notes on whether the steps were followed from the instructions phase. This might include taking notes on whether the prompting was used appropriately and timely after the SD is given, the use of all materials for the procedure, having these always with the client during session is important, and so that should be checked, as well as following the steps in order prior to using the coping tools. So making sure that we do present that feelings visual before we are presenting the option for the coping tools. And then also delivery of positive feedback following the use of the tools. We want to make sure that we're reinforcing the client for taking that break and independently, if they're independently choosing those tools and using them as was desired. In our feedback phase, this phase is critical in the BST model, and the practice and feedback may continue until the tech is successfully practicing the skill with the client and it has incorporated the feedback received as well as mastering the skill. So in the feedback phase, the BCBA will provide constructive and positive feedback on the steps implemented during the rehearsal phase. Constructive feedback might include commenting on areas to work on to improve treatment integrity. For example, saying, I would like you to make sure you're prompting the client to follow the sequence that he made initially. Or I would like more positive praise following completion of the sequence. So you're giving pretty direct statements that are influencing the way that you would like the procedure run. And positive feedback should also be given when they successfully complete and follow the steps of this DRA coping sequence with the client. As if they're using the visuals as intended, you could praise them for doing this and having, the materials that they need ready. This also gives praise at the appropriate times, and that is an important thing to praise for your technicians. So looking at some insufficient work performance, it allows the BCBA to recognize what behaviors are not occurring enough and operationally define what desirable work behaviors are needed. So performance diagnostics looks at antecedents, behaviors, and consequences that lead to the insufficient work performance. Some antecedents might include lack of training, overwhelmed by aspects of the treatment, and also criticism for not performing something sufficiently in the past. This can also stem from working with other clients, burnout, just other environmental factors. Our consequences include escaping from undesirable tasks, feeling helpless in the process of teaching a new skill, and if the BCBA allows insufficient performance, there will be no changes in the technician that is performing with the client, and also the client will not see progress in these areas. I do not have much experience working on function-based strategies for training and coaching techs at this time, but I do believe the intervention will be personalized to match the function of the challenging behavior, and this should include one-to-one discussion and feedback once an intervention has been deemed appropriate for that individual. So one example is if I were to observe a conflict with work performance due to, for example, a technician is always eating during a client session, and it's consistent every day, the client or the technician is eating during this client session. I would make a plan for discussing what type of snack or lunch break would work best for their daily schedule, because maybe they don't eat breakfast and they are hungry at 11 when they get their second client. So we should ensure that the technician is having lunch rather than working on notes during their break by offering a 15-minute time for notes following the end of their session. This might be a quick and easy fix that matches the tangible for food, and it will reinforce eating during the desired time, which would be their lunch break.